I'm Shannon.
I'm Antje. We're the CoolSculpting team here at AMA, and we want to show you a demonstration today on Shannon.
Alright everybody, so we have an awesome CoolSculpting promo running right now. If you are somebody that is potentially a candidate for CoolSculpting, you might be interested in this one. It's up to $500 off. There are a few different pieces as far as restrictions. Yep. So there's coupons that might be in your portal, but call the front desk and we can help you with that. You can definitely come in for an assessment with myself or Antje, because there's tons of different areas that we can treat here with CoolSculpting.
And this promo runs all the way through December 31st.
End of the year. So give us a call. It's definitely something you can come in, consult, and then we can assess certain areas. So far as CoolSculpting, for those of you that are new to it, there's different hand pieces that we have here. We do have two devices, two machines. So we're able to dual sculpt, in other words, treat two areas at the same time, like back fat or flanks. Certain people, if you want to treat arms, legs, stomach, we have different applicators that can be used.
We can flip-flop, we can do an arm and a leg, a stomach and a leg.
Yep.
So many variations are possible.
Yeah. So today we're going to show you a little bit of posterior back. On myself, which will be so fun. And we have a bunch of different other little applicators. This small one, for example, can treat areas like around the knee, small little pockets. It's great for all of us who just like this region here, or submental, which is our most common area for this little guy. Over by Auntie, if you pull that big guy over there in the corner. For stomach, it's most commonly used, so we do have smaller and longer applicators depending on regions and candidacy. And then of course we have other hand pieces like this one, which can be used most commonly for the outer thigh.
Or stomach, for candidates who might have some sort of muscle tear or hernia. That kind of use the other applicators, which would utilize suction.
Yeah. So for the most part, all of these applicators except for this one, what it feels like is almost a big old vacuum suction gripping onto the area of treatment. And then of course the cooling takes place, thus CoolSculpting. The entire process is something called cryolipolysis, which is a permanent destruction of those fat cells using freezing. So that's what we're going to demonstrate here today.
Okay, so we've already marked Shannon's areas that she wants CoolSculpted today. So right here you see the outlines of two ovals, and that's exactly where the applicators are going to be positioned. So to protect her skin and also to create a really good vacuum seal, I'm going to apply this cold pad, and it's really, really cold, so I'm sorry, Shannon.
Oh, good.
I'm sure this doesn't feel so good.
It is worth it.
How does it feel?
So good.
It feels like cold slime. Can you lift up a little so I can tuck that under there? This is gonna get a little bit sticky.
No worries. So yeah, the sticky pad is definitely preventing and protecting the skin from cold temperatures with the freezing of the applicator.
For the applicator.
We got negative 11 degrees Celsius getting on this bod.
So this is the area that's going to literally pull in the tissue. So I'm gonna go across so you can see this a little bit better on this side. So I'm gonna put it right over where her marking is. Okay, so I think we have a little suction here. And then we're gonna hop around your Alex. Do the same thing on the other side. Shannon, what do you feel?
I feel just a tiny, tiny little pinch of tissue.
So Shannon is perfectly hooked up to both devices right now. I turned the cold on, so do you feel like it's starting to get a little stingy?
I feel the chill factor.
So the first 3 to 5 minutes, you can definitely feel it. It's almost like playing with a snowball and then running your hands under cold water. But after that, your tissue becomes literally numb.
Yep.
So what happens after the 35 minutes, we take the applicators off, and then you will see almost like we call it like a frozen stick of butter in the shape of an oval where the applicators were. And we will apply like a 2-minute post massage, and that breaks up all the fat that isn't completely destroyed, so that it can be delivered through the lymphatic system, and we get rid of it literally by excretion.
Yeah.
So she might feel a little numb for a few days, but there's absolutely no downtime, and she could go work out after this. So it's like the perfect even lunchtime treatment.
Yep. Super easy. What's awesome is literally this whole treatment is done in 35 minutes, give or take the massage. So super easy for all these hard to treat, hard to reach areas that are just a little stubborn.
And one of the questions we often get is how soon do we see results? So I usually say about 6 weeks until you notice. I've had CoolSculpting done. I feel like it's a little bit like almost peeling a potato. Every day it's a little bit more in terms of contouring. And then of course sometimes people need additional treatment. So one time may not be enough. Depends how much tissue there was.
Yep. We can definitely give you a nice assessment and decide which applicators and how many times you need to get treated.
So we've removed the applicators, and now comes the 2-minute post massage. You see where the tissue is kind of red? That'll go away within about an hour. So what we're doing, we're breaking up the still fat cells that have not been completely destroyed, just with that pressure that they literally are gonna pop. And then they're moving to the lymphatic system, and then over the next few weeks, they're eliminated by excretion.
It's a nice little back rub.
Yeah, I wish.
Get in there. All right.